Well, thank you very much, Pat, and good morning, everyone. It's my pleasure to add my welcome to this public briefing on our newly released report, The Evaluation of PEPFAR. I'm very appreciative to all the members of the committee and its chair for your extraordinary service in making this report possible. I also want expressly to acknowledge the leadership and our staff, particularly Bridget Kelly and Kimberly Scott, who are also with us at the front table, who led a group involved in this extensive evaluation that Patrick alluded to. We at the Institute of Medicine describe our mission as to serve as advisor to the nation to improve health. We also say that our mission embraces the health of people everywhere. And there's no topic, I think, that more aptly captures both parts of that responsibility, to advise the nation and to serve the needs of the health of people everywhere, than this evaluation of PEPFAR, than the challenge of HIV/AIDS in the world. And it's because that this committee was asked by the Congress, the Institute of Medicine asked by the Congress, to please take a thorough, comprehensive, careful, systematic, objective, independent look at the performance of PEPFAR, that we are able today to present to you the conclusions and the recommendations of this comprehensive effort. Patrick alluded to the first review that was done in 2007 at the Institute of Medicine of the program in its first 3 years. What I want to emphasize is that the current effort was not simply an update, but rather this committee was asked to look at the totality of the performance from the beginning to the current date, the trajectory, the course corrections, the improvements that would still be possible. Health is a universal aspiration in the world. And I believe that there's no tool more powerfully positive than health to serve as a vehicle for international connectedness and improvement. As a vehicle for diplomacy, as a vehicle for international cooperation, as a vehicle for humanitarian assistance, and to serve the universal needs we all feel for health. There's nothing that is more appropriate than the kind of program that the United States mounted through PEPFAR over this past decade. We want to do it well, and we want to make sure we do it in the future even better. And it's with those goals in mind that this committee set out in its systematic, comprehensive, careful, and objective way to assess the evidence and to come forward with their recommendations. I want to just take a moment to introduce the committee who are here and who will now be in a position to present some of the key findings and recommendations of the report in advance of hearing from you your questions. And I want to begin to my immediate right with the chair of the committee, Robert Black. Bob is the chair of the Department of International Health and also serves as the Edgar Berman Professor and the director of the Institute for International Programs at Johns Hopkins Bloomberg School of Public Health. You know how you attend some meetings and there's a disembodied voice with a telephonic connection that you hear but cannot see. Today we've got the inverse. We can see Bob, but his voice is practically gone, so we'll barely be able to hear him unless anyone asks a question or makes a comment that he finds so irresistible that he will have to make some effort to express himself on. And maybe we'll get a big blackboard, Bob, that you can write it out. But I'm so pleased that you are here, even though your voice is somewhere else for the moment. But I also want to express to you, my deep thanks for chairing the committee. Next to Bob is Jen Cates, who is the Vice President and Director of Global Health and HIV Policy at the Henry J. Kaiser Family Foundation. Jen served as a member of the committee, was instrumental throughout its work. Next to Jen is Ann Kurth, who's a professor and executive director of the Global Division at the New York University College of Nursing. And it's a pleasure, Ann, to welcome you here and to have the service that you have provided also to our committee. And next to Ann is Dawn Smith. Dawn is a medical epidemiologist who is based in the Division of HIV/AIDS Prevention at the Centers for Disease Control and Prevention, and by virtue of her expertise also served as an instrumental member of the committee. I want to add my thanks to all who served and all who worked on the staff of this report. And I believe, Dawn, that in the absence of Professor Black's voice, that you are to go next and to introduce the basic background of the committee. So with that, I join Patrick in thanking all of you for being here. I look forward to hearing and learning your reactions and your questions, and we're very, very pleased to be able today to present to you this public briefing on the evaluation of PEPFAR. Dawn, the floor is yours.